Thank you and good afternoon. So today being Monday, we're reporting on 3 periods from January 22nd to 23rd. We had 527 new cases of COVID-19 diagnosed in British Columbia. From the 23rd to 24th, an additional 471 new cases, and in the last 24 hours, 346 new cases. That brings us to 1,344 new cases diagnosed with COVID-19 in British Columbia this weekend, 3 of whom were epidemiologically linked, bringing our total number of people diagnosed with COVID-19 to 64,828 in British Columbia. Of the new cases, 314 people were in the Vancouver Coastal Health Region, 618 people were in the Fraser Health Region, 73 people were in Vancouver Island Health, 234 people were in the Interior Health Region, 104 people were in the Northern Health Region, and 1 person was a case who normally resides outside of Canada. We now have 4,392 active cases across the province, of whom 328 are in hospital, 68 of whom are in critical care or ICU. We have over 6,607 people under public health monitoring because of exposures to COVID-19, and 57,831 people are considered recovered. Again, this weekend, we have had new deaths from COVID-19. 26 people have died this past weekend. Our seniors, our elders, our family members, our community members, and our hearts and thoughts go out to all who have lost people this weekend. This is a very challenging time. Continuing to be a challenging time to lose somebody, especially from COVID-19, and our thoughts are with you. We've had 1 additional healthcare outbreak at the Nanaimo Regional General Hospital, one ward at that hospital. And on a very positive note, we now have 11 outbreaks that have been declared over. At the Avalon Gardens, the Braddon Private Hospital, the Fraserview Intermediate Care Lodge, the Good Samaritan Delta View Care Lodge, the Menno Home, one of the larger of our outbreaks, Peace Arch Hospital Foundation Lodge, Sunrise of Vancouver, the Harrison at Elam Village, Waterford Retirement Residence, Williams Lake Seniors Village, and the UHNBC Rehab Unit outbreak have all now been declared over. And this brings a moment of happiness to us all and relief for many of the care providers and the families with loved ones in these facilities. And I think it is a reflection as well of how important the immunization program that we've had in long-term care over these last few weeks and the difference that it's going to make and continues to make. We now have 29 active outbreaks in long-term care and assisted living, and 9 acute care units. These involve 1,009 residents and 579 staff. Currently, we have 1 new outbreak in the community at the Surrey Emergency Response Centre and in the Fraser Health Region. On Friday, along with Premier Horgan, Minister Dix, and Dr. Ballum, we shared the details of our province-wide COVID-19 immunization plan and our age-based approach that will follow on from the phase 1 that we are in currently. Everyone in BC is important, and everyone who is eligible will have access to the vaccine as soon as we have vaccine available. What we know is that no matter where you work or what you do, age is the predominant risk factor for having severe illness or dying from COVID-19. And the approach that we are taking ensures that those who are at highest risk of illness and death receive the vaccines first. This weekend, unfortunately, we received additional information about holdups to the to the supply of the Pfizer vaccine that we were expecting to receive in the next few weeks. This next 2 weeks, we're going to have very little vaccine. As we knew, we are receiving no Pfizer vaccine this week, and it is also a week where we do not receive any new vaccines from Moderna. We have to manage our supply within the limited amounts that we have. And on this weekend, we found out as well that the amounts that we were expecting to receive in the first week of February have been dramatically reduced. And we right now do not know how much, if any, vaccine we'll be receiving the following 2 weeks in February. We know that the federal government is doing everything in their power to make sure that our vaccine supply gets back on track as soon as possible. But within what we have right now and what we know is coming into the province, we need to make some changes to the phase 1 that we are in at the moment. Because of this extremely limited supply over the next 2 weeks, we have made the decision that we will be delaying second doses up until day 42 for these short period of time. This means we can use what little supply we have right now to finish our long-term care home immunizations and to address the outbreaks that are happening in our hospitals and our communities. We know that addressing these, in particular, the most vulnerable people in our communities and in our acute care system, will protect all of us going forward. This is about putting out fires before they get out of control. It's about choosing in the short term to give more people this protection from dose 1 instead of giving some people full protection and leaving others with none. We will make up these doses, and we will be providing the second dose of vaccine to everybody as soon as we possibly can. In the past week, we have delivered 119,850 doses of vaccine. That's 87,788 doses of the Pfizer vaccine and 32,062 doses of the Moderna vaccine in British Columbia. That's of the 144,500 doses we have received as of today. And it also includes 3,193 second doses for some people who got it at the beginning. I think importantly, though, we have, as you know, been focused on long-term care and assisted living, where we know the risk is highest and the impact is greatest. And as of today, I'm very pleased to say that we have immunized 33,023 long-term care facility staff, 25,701 long-term care residents, and a number of them, several thousand, close to 3,000, have received as well dose 2. In addition, we've immunized 4,050 staff who work in assisted living and 7,147 residents in assisted living. What this tells us is that over 60% of the vaccine that we have to date has gone to protecting those who are the most vulnerable in long-term care and assisted living. And that I'm very grateful for, and my hat goes off to all of those who have been running the immunization programs to protect those most vulnerable. That includes all of the long-term care and assisted living facilities in the Island Health Region, Vancouver Coastal and Fraser Health, and we will have all of the long-term care and assisted living facilities in Northern Health and Interior Health completed by the end of Wednesday of this week. That is an amazing feat. In order for a vaccine to be approved for use in Canada, as we know, it must go through extensive safety reviews. But it's also incredibly important with new vaccines, especially new platforms like the ones that we have that are working incredibly well, that we monitor very carefully for safety. And so today I wanted to report as well on the safety signals that we've been following in British Columbia and reporting nationally, what we call adverse events following immunization, or AFEs. And there is a very strict criteria that we use for monitoring these, and the reports come into the BC CDC. We have a committee that looks at the serious reports and looks at their association and whether they're caused by vaccine or not. We know that when we're immunizing people who are elderly, who have underlying health conditions, that there are other things that will happen when we're doing immunization programs in large numbers of people. So it's very important for us to know exactly what vaccine people got when, down to the lot number. So far in BC, we've had 56 reports of adverse events following immunization in the close to 120,000 doses of vaccine that's been given. We've had 10 reports of anaphylaxis, or serious reaction to the vaccine. That's about 8 per 100,000. That is slightly more than we would expect based on other immunization programs, such as for influenza, for example. We had 1 hospitalization out of those 10 people who had anaphylaxis, but all have recovered. In addition, we've had 16 other allergic reactions that were associated with the vaccine, and 1 case of what we call Bell's palsy, or paralysis of part of the face. That's something that we've seen reported in the trials for this vaccine as well. So this is important for us to continue to follow. So far, there has been no associated deaths from immunization, and we are monitoring all of these safety signals very carefully. As part of our provincial monitoring as well, we've been paying careful attention, as you know, to children with COVID-19 symptoms, and we have a surveillance system for multisystem inflammatory syndrome in children, or MISC. And to date, as I reported last week, we have had 6 children in BC who have been diagnosed with MISC. So that is children who have had the symptoms that are associated with this inflammatory condition and have had a positive laboratory test or exposure to COVID-19. So we have 6 confirmed cases. They were 3 female and 3 male. They ranged in age from 1 to 15 years of age, and all of them are either recovered fully or recovering. In addition, we monitor all people who might have symptoms that could be associated with MISC, and this is something that we've seen for many years, a syndrome called Kawasaki syndrome. It's very similar to that. And so we've had 19 additional children between the ages of 0 and 17 who have had an investigation, and none of them have turned out to be associated with COVID-19. Finally, I've been reporting weekly on a number of issues that we see, these both around immunization and also around the surveillance that we're doing for variants or new strains of COVID-19, what we're calling in Canada and around the world variants of concern. As we saw from the start of the pandemic, we can use things like whole genome sequencing to help us understand how the virus is traveling across the country and through the province and around the world. There are now a number of variants circulating worldwide that are proving to transmit more easily than the ones we've seen in the past. In particular, we're concerned about one that has been labeled the UK variant, but it is technically known as B117, and we have had 5 cases of the B117 variant detected here in British Columbia. All of them are either related to travel or related to close contact with a traveler, including the 3 initial cases. So far, we have had no ongoing transmission from any of the 5 identified UK cases. In addition, we've also had 3 cases arise through our surveillance of the B1351 variant, and this is the one that has been linked with increased transmissibility in South Africa. All 3 of these cases were community acquired, so they were not linked to travel, which is of course something we are concerned about. they weren't linked to each other, and we're now investigating. 2 were in Vancouver Coastal, 1 in the Fraser Health region, and Public Health is doing backward contact tracing, trying to determine where they may have acquired their infections. These are, of course, concerning, because we know that if we start to see rapid transmission, that we could be in a position where we're having way more transmission in our communities than what we're having now. We have been following using whole genome sequencing through the BC CDC from the very beginning, and we've sequenced about 11,000 samples so far. And we continue to monitor in areas where we are seeing ongoing transmission, where we're seeing rapid transmission, and where we're seeing transmission in, for example, younger people, to determine if these variants could be associated with disease here in British Columbia. So far, we have not seen widespread transmission, but it remains a concern and something we'll be watching carefully. But we also need to know that the things that we do to prevent transmission of COVID works for these variants as well. There are several things that I need to speak to you about this today. First, and most important, is to make a very specific request of everybody in British Columbia. In the last couple of weeks, we have plateaued at about 500 new cases of COVID-19 a day. This is too many. This leaves us at a precipice, at a brink, where we can see rapid takeoff, particularly if we start to see any of these new variants starting to transmit in our community. This shows us that while we're getting a handle on long-term care, the virus continues to circulate in our communities. And our immunization is working in these high-risk settings, but we are still at risk. We're at the threshold of where we were in late October, November, when cases started rapidly escalating. And we need and know how to stop this. We can either go up, and where we've seen that happen in other provinces, in other countries all around us, we will have more people severely ill. When we have lots of people infected, even young people become severely ill, end up in hospital. We will have more of our family, our community, who are hospitalized, who need ICU care, and who will die from this virus. We will have more of our healthcare workers under strain, and more restrictions will be needed to slow things down in our community. Or we can have less. We are now into the second incubation period from our winter break. Less is where we need to go, and I need your help to get there. Over the next 2 weeks, I believe we can bend our curve. Not just plateau, but bend it back down. And this is at a time that's critical, where we have very limited vaccine, and we need to target it where it will do the most good. The public health restrictions in our province are dependent on what we all do now. My ask of you is to take a step back and remember that COVID-19 is still that unwelcome guest in our homes, in our workplaces, in our communities. I'm asking you now, as much as possible, more than you've ever done before, to stay home, to stop those social interactions, to focus on the key things that are keeping us together, focusing on our work from home if we can, focusing on making sure children can go to school, focusing on making sure our healthcare system can continue to function. This is the most challenging of times for us. It's not the time to falter, despite us being tired and frustrated and wanting it to be over. We need to hang in there. We are so close, but we need to do this now. We need also to remember to find joy every day, to find those things that get us through this, We've been in this for a year now. We know there are things that we can do to support each other. We know how important it is to go outside every day, to get a little bit of fresh air and perspective, to make sure that we find that moment where we can listen to music, where we can look at art, where we can find theater online, those things that give us that joy in life. To make sure we hug each other, that we take care of our family that we're close to in our households, and that we reach out virtually and care for those who are around us in our community. Right now, we can't rely on the vaccine to protect us all, yet. It's our individual efforts now more than ever that will have the impact that we need right now in these next 2 weeks, so that we can get back to having those social interactions we all want and need. For the next 2 weeks, I am asking you to do more. Take a step back, stay home, stay away from others, join in our effort to bend our curve. We need to share these messages with all of us. It is our time again that we need to make this work. With your help, I believe we can get there. Across our province, today, tomorrow, we can make a difference. And we need to do that as we have been, by remembering to be kind, to be calm, and to be safe.